Why do we have to learn about periods? At SHV, a lot of our work with young people is around puberty and specifically periods. And recently, we were awarded a grant by the Department of Education to deliver menstrual and pelvic pain education to young people all across Victoria. And we do an inclusive approach, so everyone, regardless of your gender, is included in what we do. However, when we present this at a lot of schools, both young people and teachers always ask us things like, but why do we have to learn about periods? Specifically in the context of why do boys have to learn about periods? Which is something we address quite a lot. And so that is a running theme throughout the stuff I will be talking to you about today. Really, I want to talk about building health literacy, specifically on menstrual health and pelvic pain. And I'm going to use an example of what we're doing at SHV to show how other people can do this education. While we feel very lucky that we can deliver these sessions, especially that all the costs are covered by the Department of Education, we are not gatekeepers of what we are doing. We want this education to go to everyone. So we want to help support other people in set up these sessions or some things that are similar in their own schools or communities. Before I would begin today, I want to thank the traditional owners for the land that we are all on today. Specifically, I want to thank the Wurundjeri Willam people. I want to pay my respect to elders past and present, and I also want to extend that respect to any First Nations people in the session today. This land was never ceded. It always was and always will be Aboriginal land. It is very important to acknowledge that First Nations people in this country have different approaches to talking about and managing sexual and reproductive health topics, specifically things around periods that differ from Western cultures. And that has been taken into consideration with this work. The key messages of what I will be talking about can apply to anyone and to all kinds of communities, but the delivery of these key messages can be applied differently depending on what is culturally appropriate. Now, as we're talking about things like periods today, we know that we live in a diverse world where everybody is different, and these differences impact how people talk and manage their period. People have the right to manage their periods in whichever way is best for them. The way that people manage and talk about periods might differ depending on their culture, their faith and religion, and the languages they speak. It can also differ in how their bodies work. We know that not everyone that identifies as a girl or a woman has a period. There are people with different kinds of body parts that will also, or different gender expressions that will experience a period. So the way that we approach this at SHV is to teach with an inclusive approach. As well as we know that people's periods can be impacted by disabilities that they live with. And so everyone has the autonomy and the right to manage a period in the way that they feel is best for their body. In the session today, I'm going to cover some kind of key components about the importance of menstrual health education, not because I think that this room doesn't know the importance, but mostly because why we are talking about it in such an inclusive and expansive way. Also, so that way, if people want to do work on this and want to hunt for funding, how they can advocate for that funding using some key statistics around periods. I want to show you some health promotion strategies and principles that underpin this work that can also help in the advocacy for this education and kind of show you how we've set up this program at SHV. Also, I'm going to use our menstrual health and pelvic pain program to talk to you about like how we've done it, what we're doing, and then also talk about some free professional development sessions that we are running. That if you are interested in what we're doing and you want more information post what I show you today, you can get in contact with me, or you can head to our website to find out more about this free PD that we're doing so you can actually see examples. Today, I'm not going to go through how to teach certain topics or like the content very in like specific detail, but I am instead going to show you how to set up a program. And then if you are interested in more, I'll direct you on to our PD that we are doing that is funded by the DET. And then I'm also going to go through some key topics that you can use with young people and also with professionals, whether it's health professionals or educators. So why is this education so important? Like I said before, we all know that this education is important, but here's some evidence to prove the impact of this work. So you can take it on, for example, if you're advocating for funding, or if you're advocating for this to be a more important part of your work or more prominent part of your work. Here is some evidence that you can use to advocate for people, or to like funders, to management, to be like, here's the evidence, this is why we need to do it, please fund it or please support it. So before I go through the important messaging, I want to ask you some questions around your own experience of puberty and period education, if you're willing to share with me. So I'm going to ask you to put your answers in the chat. Also, if you'd like to take yourself off mute and answer as well, you're more than welcome to. The first question I want to pose to you is, did you learn about periods or menstruation in your school-based sexuality education? We've got yeses. Um, I'm not going to lie, the visuals that I've used in this presentation are very specific to me. Whenever I think about the education I received as a young person on periods, I think of the tampon in the water demonstration, which is something that I now do in sessions with young people, but I make sure that it is more expansive than just showing them a tampon in the water. And I also make sure that it's not separated by genders, because that was something that was my experience. I love hearing when people's parents are nurses, because you can really tell in a classroom session with the way that young people ask. One of the responses is learnt in high school, but that was way too late. Part of what I'm going to be talking about is advocating for this early education. Sometimes schools can be really hesitant to do like an inclusive RSE program at like year 3 and 4, but we know that these young people like can expect a period from like starting from around the age of 8. So if you're 8 and you haven't received your school-based RSE, and potentially your parents are uncomfortable talking about these topics, it can be really confronting. And so we really want to hit young people before they go through these experiences, whether it's periods or things like other topics like sexual activity as well. Oh, last response. No, not at school, at a netball breakup party. One thing that we don't really discuss all the time is the fact that young people, or when we were young people, receive a lot of this education outside of a school-based setting, whether it is like hopefully also with parents. But a lot of us have the experience of like, we didn't learn it in school. We are learning it ourselves in our personal lives. We are going and hunting for this information from other sources, and often that can be our peers. The next question I want to pose to you is, did you learn about pelvic or period pain in your school-based sexuality education? Sadly, lots of no's. I can't recall too long ago. This is definitely something that is, whenever I ask this question in PDs, everyone is saying no. I'm really hoping that the next generation of young people can have a different answer, because this is really discouraging to hear. If we got period education, or if we had some type of sex ed as a young person in school, it almost always didn't include things about pain, or pelvic pain, any kind of pain relating to periods as well, which means that a lot of young people, or like now adults, don't know how to, or don't know when they're experiencing some type of pain. They kind of believe that it is expected, it is something regular or typical part of a period, when in fact it isn't, and it is something to seek help for. My last question for you is, was your school-based sexuality education separated by genders? Now, if anyone gets this show reference on the screen, I really hope someone gets it. It was a show that I grew up on, but it also shows that a lot of this education has been separated by genders. We put a period education in the girl stuff. We'll teach that to the girls, and stuff like wet dreams in the boy stuff category. So you can see some no's. I always hope to see that this stuff wasn't separated by genders. In some cultural contexts, it absolutely is appropriate to separate by genders, but often in regular mainstream schools, if it's separated by genders, it means people are getting different education, especially when we head to high school. It means that sometimes the conversation around sexual violence means uh, young girls get taught how to defend themselves from men, and young men get taught, I'll get like a police chat of like how not to commit violence and stuff like that. Tamika said girls had 2 period lessons, boys went outside and kicked the footy. That is still very common. So we're aiming for inclusive education with this program here. So when we go out to schools, we always kind of ask that they teach that everyone gets the same information. And if things have to be separated by genders, like we will say that all students will receive the exact same information, regardless of what session that they are in. Thank you all for sharing your experiences. I'm hoping that the standard of RSE that we are aiming for and that we are ourselves delivering is higher than what our experience has been ourselves. This question that I've wrapped all throughout this presentation, but why do we have to learn about periods, is something that is so common, specifically around the menstrual health and pelvic pain sessions that we're doing. Even when we do our regular program and we teach people of all genders around periods, we often get, but why do the boys have to hear about this? But I am hoping in the future that we don't have to hear about this specific question as much. I would like to ask you now, if you were to receive this question in a classroom or from a young person, why do we have to learn about periods, specifically with that lens of why do boys have to learn about periods, how would you answer that question? Or how do you think you'd answer that question?
I would say so you can understand how your mother or your sister or your cousins or your aunties feel, and yeah, so you're aware of what they have to go through.
Yeah, amazing. Our stock standard response is we will get young people to put up their hands. We'll ask them a series of questions. We'll say, are you going to go to school with someone in your lifetime that will experience a period? Do you live with someone who will experience a period? Do you think you'll ever meet someone who in their lifetime will experience a period? And by the end of those set of questions, everyone should have their hands up, because in your life, you will encounter someone who will experience a period. When young people go to school, we don't just learn about what happens to us. We don't learn about what happens to like people of our race. We don't learn about just things that happen to our bodies. We learn about things that happen to everyone, so we can learn more about different perspectives. We can learn about different parts of history. We can learn about other experiences. So it is also empathy building. So some of the ways that we also answer this is understanding things like periods helps us understand things like pregnancy, because one day people might want to have babies. And previous to working at SHV, I used to work in the fertility and preconception health promotion sector. And the amount of adults that don't have a good understanding of a typical menstrual cycle when it comes to then trying to conceive it is massive. It is the basics of periods that, because they didn't receive that as a young person and no one has it has never been explained to them, and they've never really sought out that information until they've been trying to conceive. It means there's significant like gaps in knowledge, and this can be really helpful for the future. We also want to build that empathy, like I said before, making sure that young men understand how to support people who experience periods. Things like during puberty, we know this can be like an embarrassing time for lots of people, regardless of what kind of body you have. You might feel shame or embarrassment when certain things happen. So we're teaching you about all these different elements to show you that if you see or notice, like for example, blood on someone's school uniform, you don't say something to embarrass them or make them feel even more feel shame for their experience that they can't control. If you have that knowledge, you'll instead be supportive and maybe tell them quietly about it, or even like for example, if they're experiencing pain, getting them help, whether that's heating up a heat pack for them or going to a trusted adult to get support or medication, things like that. I've got some statistics around some of the stats around menstrual health and pelvic pain conditions in Australia. I'm not going to spend too much time on the prevalence because we know that these conditions exist. We know that they're prevalent. This is a group of supporters here, but these statistics here can be really useful in advocating for including stuff like if you're already teaching puberty education, including specifically things like pelvic pain into the session because it is really quite prevalent. So we know that in Australia, people around 1 in 7 people with a uterus are impacted by endometriosis. 1 in 5 people with a uterus are impacted by adenomyosis. There are also PCOS and PMDD to think about. These are hormonal conditions that don't often get included in education. We know that endo has been really popular as a health topic across the news, and especially with the government supporting education on this topic. But endo isn't the only condition associated with pelvic pain or associated to menstrual health. There are other conditions that play into this that we also need to be considering in how we talk to young people. It looks different across different ages, but these topics are really important to incorporate from a young age so the young people can understand what is expected of a period, so that they know when they're experiencing something that is not expected and can then seek help. Research in Australia shows that young people do not seek medical advice for their menstrual symptoms, but often rely on information from the internet and frequently engage in self-managed medication for pain relief. So Tamika mentioned at the start of her talk, people seeking information online, and that's something that we can see is increasingly prevalent when it comes to periods and period pain. Research in Australia has also shown that menstrual health literacy is really low, and it's also really low worldwide. We know that Australian adolescents are now unable to identify symptoms of an abnormal menstrual cycle. And even if those symptoms are abnormal, they would not seek medical advice. But it is not all doom and gloom. A 2022 Australian study found that menstrual health resources improved how young people defined normal periods, how they managed menstrual symptoms, and increased help-seeking behaviour. So rather than focus just on the negative stats, I want to now carry it on to this. We know the information, we know the prevalence of these conditions, but we also know that creating resources and creating education for young people can have a significant impact. And it's how do we create these education pieces. So because I have a health promotion background, I like to think about how we've set up our program within health promotion strategies. So there's kind of 3 key things that stood out to me when we were creating this piece of work. It really focused on prevention, so upstream thinking. So I'll explain that more in depth in a second. It also centered around health equity, making sure that this information was inclusive and accessible, and then health literacy, so building that knowledge and building that language. So our first strategy is upstream thinking, which is a public health strategy. So if you've been in the public health space, you've probably seen this, or every time I go through this, I have flashbacks to my Masters of Public Health. So I hope I do this explanation justice. This strategy is all about prevention, and it's targeting health problems in order to reduce the impact on clinical care and treatment. So to understand the principle of this strategy, I want you to picture yourself downstream of a river. It is sloping down from a mountain. It has quite a strong current, and you're standing near the riverbank, much further from the top of the mountain. You notice a person struggling in the river right in front of you, and they look like they might be drowning. What you do is you jump in and you bring the person out to the riverbank. Once out, you notice another person in the water and they're struggling. So you jump back in to help them. As you're swimming back, helping bring this other person to the shore, you notice another person drowning. Now, at some point, the question becomes, why are there so many people struggling in the water? Why are there so many people in a dangerous situation this far down the stream? Now, one person logistically can't help everyone that are struggling in the water. So to properly address the problem, you need to head upstream. Now, in this analogy, You are not worrying about people drowning in the water. In this fantasy, they are being helped. This often doesn't get explained when we talk about this strategy as a whole. But just don't worry about people drowning. They are being helped. So what you do as someone who wants to fix the more systemic problem to help prevent less people from being struggling downstream is you head upstream. You go up. You see that there's a lookout point higher on the mountain, and you notice that a guardrail or a fence that it was protecting people from falling down has been broken. It now has left a massive gap in that fence so people can easily fall out across the edge. This explains why so many people are now falling into the river. To have a more effective and long-term solution, you work on fixing that fence. This will help reduce the amount of people falling in to the river and reduce the amount of people needing to be saved further down the river. This metaphor really can be applied with health problems. With early education, things like our program, it is heading towards that more midstream or upstream approach to reduce the amount of time it takes people to get into clinical care. If we think about menstrual health and pelvic pain problems, it helps people target people earlier in their health journey to improve their knowledge, improve their language, and help them seek help and advocate for help. Because we often know when it comes to menstrual health, there is a gendered lens to this. So when we talk about these problems, we're also talking to young people about how to advocate for themselves in the medical system if they are experiencing things like heavy menstrual bleeding or pelvic pain. If one doctor doesn't listen to them, they have the right to go seek other help and keep asking for help until someone listens to them. This kind of strategy targets the problem closer to the root, so that way you can spread out the burden on clinical treatment across a number of years or across a period in people's lives. So rather than having people, for example, collapse while at work and have to head to ED because of pelvic pain, if it is targeted earlier, people can think of different strategies and potentially receive care, treatment, surgery earlier in their life to reduce other health complications in the future. Then we move on to health equity, which goes beyond health equality. It means that these kind of programs are targeting everyone's needs and it acknowledges that not everyone will need the exact same information. You have to cater differently for different groups, depending on things like ability and culture and health literacy as well. This approach means that access to health information and resources is more accessible. It is more broad, and people who typically aren't getting this kind of education can now receive it. This means that this education reaches people regardless of where they live, what kind of body they have, and regardless if they have a disability. For example, in this program that we have funding from the Department of Education, it means that schools that have never had SHV come in or external providers come in opportunity to have us come in for free. They don't have to use their own funding to pay for a program like this. They can also have some dedicated time for these topics when usually school curriculum is really, really packed and it is really hard for teachers to fit in everything they absolutely need to or whatever's on the wish list as well. So sometimes pelvic pain can fall into that wish list item. So having an external provider like us come in free of cost means they can dedicate time to this kind of topic. It also means that schools can deliver this education themselves because the professional development from this program is funded. It can, yeah, like I said, it can be really hard to prioritize different topics within health and PE curriculum. So this provides more time, access to expertise, and more education in general. Health equity also means that we tailor these sessions for the people attending. So this includes showing people different types of period products and different ways to manage periods. This can be really useful for example, people who have mobility issues. Certain period products may not be useful, like if someone has dexterity problems, we can show them, like, for example, Modi Body have period underwear that have buttons that can be used to like release the underwear from the body. Because some of the period products, if you have a certain amount of time for puberty education and you can only go through pads and maybe tampons, we have the time within this program to show a diversity of products that can be used and adapted to people with different needs. Health equity also includes like creating things like vocabulary sheets for interpreters that explain key terms used in the session, because often interpreters that will attend education sessions may not necessarily have the health knowledge or the health interpreting background that might be super useful in this context. So this means if these vocabulary sheets are created and sent to interpreters before the session, they can prepare content and prepare translations for certain complicated things based on the knowledge of like which body parts are going to be explained or medical conditions that might be mentioned. It also means having interpreters in sessions so that people whose first language isn't English can have this education in the best language that's best language for them. Health equity also means building knowledge for trans and gender diverse people accessing this information, because sometimes if these sessions are gendered, it means that a trans person might have to choose between which session. Are they attending the boy session? Are they attending the girl session? And it may not necessarily align with the health information that they need. So doing this doing these sessions with a health equity approach means everyone receives the same education, and this education is taught in an inclusive way. Especially at an early age, before people need to think about things like how periods might be affected by socially affirming their gender and or medically affirming their gender. And then all of this comes back to health literacy. So health literacy is defined as how people understand and use health-related information and services. Some ABS data from 2006 found that approximately 60% of Australian adults do not have the skills needed to understand and use everyday health information, such as using medication safely or finding the right health service for their needs. But what is important to then say right after this is that the general public cannot and does not need to know everything about all health conditions. That is an unnecessary burden to place upon people. So when building health literacy, it is important to know that as much as trying to build this information, build like a person's personal like resource deck in their mind of how to manage health conditions, there's only so much people can hold on to. But it is important to target them early so they still have a way of, they're introduced to the topic, they're introduced to it in a way that isn't filled with shame or stigma. Instead, it's filled with curiosity. So when they're older, they may not necessarily remember everything covered within an RSE session around pelvic pain. But for example, if a partner's going through pelvic pain, they can know how to look up accurate information on this topic. Or for example, like, yeah, it is all about building that curiosity about health and knowing where to find accurate sources of information. And this can affect anyone. For example, if I'd say everyone here has really high health literacy, but it may be very specific to certain topics. So while I teach around sexual and reproductive health, if somebody would ask me questions about lung health conditions, I do not know the same amount of information on the lungs as I do about the uterus. So even if you have high health literacy, it is expected that there are certain content gaps, but as long as you know where to find accurate health information, that is the core skill that we would like to build here. And speaking of building health literacy, we know that a lot of people, especially young people, are not seeking information on health conditions from accurate sources. They're instead turning to the internet, they're turning to TikTok to find this information. So I want to present you with some of these examples and see if you can guess whether the content that I'm showing you is accurate health information or is it misinformation. So we're going to do a little quiz. And I'm hoping people are ready to put some guesses in the chat. I've had too much fun with this quiz. So I've got a lot prepared. I'm only going to show you a few examples depending on time. For this quiz, I've got rules. On the screen, I'm going to show you a transcript of a TikTok video, which I'll also read out. The content is either going to be accurate health information or misinformation. The posts that are misinformation, you have to then also decide whether I sourced this from TikTok or if I made it up. I'm going to give you, after I read out the transcript, I'm going to give you around 20 seconds to decide whether this information is accurate or if it's misinformation. And I want you to consider all the information that I read out, such that is on the screen, because there's important potentially context or clues in there. You're also going to then type your guess into the chat, and then we can talk through the videos after I've revealed if they're accurate or not. If you think the information is accurate information, type the word accurate into the chat. If you think it's misinformation from TikTok, type TikTok into the chat. And if you think this information I made up, type SHV into the chat. Are we all ready to go? Okay. If my slides will change for me. Okay. Here is your first post. The creator name is Dr. Suj. They've got their qualifications in the bio. They say that they are board certified in family medicine. They don't give personal advice. The name of this video is this causing your heavy and painful periods? An image description is this is a masculine presenting person wearing scrubs and glasses with a clip-on eyeglass lamp in what looks like a treatment room. Now, this is a transcript directly from the video, so it will sound like speech pattern. Will there be information for adenomyosis? So adenomyosis happens when tissue similar to the lining of the womb starts growing into the muscular wall of the womb. It is horrible. It is really painful condition. It can cause pain at any time during the menstrual cycle. It can cause really painful and heavy periods. It can also cause bloating and pain during sex. Now, the treatments that we use are usually a stepwise form, so we can give paracetamol and ibuprofen for the pain. Ibuprofen is really good at reducing prostaglandins at a uterine level, and prostaglandins are the thing that give you the really crampy, painful periods. We can even use birth control. For example, a Mirena coil is the first-line treatment for really heavy periods, and it can really help with painful periods because it can stop you having periods altogether. Outside of this, there are surgical options. A hysterectomy, where you just remove the uterus, can be curative for adenomyosis. However, adenomyosis and endometriosis go hand in hand, and removing the womb will have no impact on endometriosis. You have 30 seconds to put in the chat whether you think this is accurate health information, whether it's misinformation I found on TikTok, or whether I made it up. Okay, we have a range of answers. I will say before I reveal the answer, this quiz is not a test of your health literacy. I'm not expecting you to feel like you have to know all this information or that it might be too easy for you. This is not a test of your health literacy skills. It's more of a test of your digital literacy skills. I can reveal that this is accurate health information. Now, I am taking away a bunch of your senses when I do this quiz. So it means that you can't see how it's presented. You can't click on a video. You can't scroll a profile. So it means some of the senses that you have usually to detect whether this is accurate information or not can be hampered. But that is the point of this, because I do expect that this is a group with high health literacy. I have scoured the internet for videos that are meant to be confusing. And again, it is me reading it out, not in the speech pattern that it was presented in, which can also influence how you answer. I'm going to give you another post. This is from Amina Khan at Amina the Pharmacist. The name of the video is 3 Things to Induce a Missing or Delayed Period. A description of the imagery you can see in the video is a femme presenting person wearing a white lab coat with images coming in from a green screen. Images of what is being spoken about replace one another on the green screen. A transcript from the video is, so your period has gone missing and you're not pregnant, and your period should not be more than 35 days long. So what do you do? 3 things you need to take to get your period back. Number 1, dates. Studies and most South Asian mums suggest that consuming dates generate heat in the body. This can cause uterine contractions and induce your period faster. Number 2, turmeric in milk. This is from traditional Chinese medicine, and it stimulates the blood flow to the uterus. Number 3, my hormone balance supplement. A missing period is usually a sign of imbalanced hormones in your body. This will tackle the underlying cause of missing periods. This supplement contributes to a normal hormonal activity in the body, which leads to regular, pain-free, no PMS periods. Submit your answers now. Lots of TikToks of answers. The answer is it is misinformation, and it is found on TikTok. This is a real video I found. What is important to think about when we think about the misinformation is the predatory targets that people use to trick people with certain parts of information. So, while this information spoke about traditional Chinese medicine, it's important not to discount this as a form of like within somebody's healthcare team. It has its like rightful place, but people use things like cultural medicine or cultural things around practices around healthcare as a way to trick people. Um, any healthcare advice should not say that somebody you can cure your illness by your diet alone or by taking supplements without mentioning talking to a healthcare provider as well. Um, People use this as a tactic to then also sell their own products. So in that video, it was talking about buying someone's hormone balancing supplement because they'll talk about things like it can boost the effect of certain things. Again, if it's without consultation with a healthcare provider, it is clear that your senses are up that maybe something is off. Um, so yeah, this appropriation of cultural practices are used as a selling tactic. Especially people often appropriate or use cultures that are not their own in order to talk about treating something with a diet. So with all these any post of here that I mentioned that is misinformation, I'm going to go through a bit of a checklist, some of things that people can use, some questions to ask themselves or to talk to young people that they can ask themselves if they find health information online. What kind of things can they go through in order to figure out if this information is accurate? So one thing that I haven't actually included on this list is if you hear someone talk about hormones imbalance, your flag should be up that maybe something is sus, because often people will talk around periods or especially anything to do with people who are born a female. They will talk about hormone imbalance and being like, this is happening, or like if people have heard of the TikTok thing around cortisol face. A lot of these things are predatory to people who are women, and so a lot of the language can be targeting things like hormone imbalances when often hormones are not balanced. Things fluctuate, especially through the menstrual cycle, but they will use this terminology to freak people out. Some of the key questions to ask is, does the person have the right qualification to be giving this information? So if someone says, if someone presents with like wearing scrubs or a lab coat in a video, that can signal to young people that they clearly have some type of expertise, but that expertise might be not right for what information they're actually giving, what topic they're actually talking about. And they use that presentation to kind of trick people to say, yeah, you should trust me. Is there mention of seeking advice or care from a healthcare professional? Because often people give advice and not say, hey, maybe you should consult with your doctor yourself or with a trusted health worker, because giving certain information may not be right for you. Like talking about supplementation, you may not need to be supplemented in certain areas, and you won't know that in case unless you go to a doctor. One of the things that's really great about social media is that people talk about their experiences. People talk about their experiences, things like periods, contraception, and that can be really validating and affirming. However, it means that people can use this tactic of sharing experiences to then sneak in certain things, be like, this is my experience. You should buy my product because that's how I solved my own health problems. Which then leads me into my next question. Is this person selling a product or a supplement, or are their solutions diet related? A lot of these harmful tactics are predatory around diet, being like, if you were to eat well, you could solve all your pain issues, which we know is not helpful information and not accurate information. And then lastly, have people think about how that information makes them feel. Are you made to feel like you can solve this health problem specifically quickly? If you just go buy over-the-counter supplements, you'll feel better immediately. Because this, again, it adds on to this thing of you should be in control of your own health. And if you're feeling things like pain, you could have prevented this if you just took this supplement. If you just invested all this money without healthcare consultation, you could fix your health problems by eating a nutritious diet. So if you're feeling pain, you must be eating poorly. All of these things are little language tricks to make people feel like they should have been doing more for their health, when often these healthcare conditions are out of they're out of their hands, or they haven't been provided with all the education needed in order for them to know that something they should be seeking health advice. Our next post is from the creator at Aoife, that PMDD girl. The name of the video is PMDD. This changed my life. There's a femme presenting person wearing loungewear, holding a mug while sitting cross-legged on a couch. This video is in response to a comment left on a previous video. The comment is displayed on the screen and reads, "But what happened after you got the IUD out?" The information given was, for those following along, I went to the gyno a few months ago to get my IUD removed because I thought it would balance my hormones. My gyno told me that the IUD reduces the lining of the uterus, so I hadn't had much of a period in 3 years. I have had the IUD in. Once my periods were back, I felt PMDD symptoms were better, but still not great. I booked in to see my gyno again, but I saw this video from a doctor on TikTok. I'll try to link her if I can find her. She said peptide AC can minimize PMDD symptoms completely, and I thought I would give it a try, and it has been a game changer for me. Here's the one I buy. Screenshot this so you can look into where you can buy it from or similar ones. I feel like I'm finally feeling like myself again. I don't dread that time before my period. I feel like me and my boyfriend are fighting less. PMDD girlies, run, don't walk to the chemist. This has changed my life. Submit your votes now. Is this accurate health information or misinformation? I think it's a bit rude that you've all immediately clocked that this is one that I have made up. So you are those who said SHV made it up. I absolutely did make this up. This is following along from lots of health information around PMDD and people using what should have been Pepcid AC or antihistamines to treat their PMDD symptoms. One of the reasons we made a post like this is that there is emerging evidence. However, you're getting this from someone talking about their experience. And if you are not then taking that into a healthcare professional before you start doing it yourself, there is some risks associated. So, yep, totally, absolutely made this up. Again, if we go through that checklist of misinformation, thinking about all the kind of things to consider, does that person have the right qualification? And does this person present themselves to be an expert? We see a lot of the time now people using their own experiences to talk about certain things that have happened to them. Again, incredibly affirming and validating, but people need to then be considerate about how they then take that in to a healthcare professional. Especially some of these things, taking an antihistamine doesn't necessarily mean something bad is going to happen. However, if you were taking other medications, adding a new medication without consultation from a healthcare professional might mean certain things don't work. They might cancel each other out. If you have certain allergies, you don't know how certain things are going to present. So it always is important to then just go seek professional help. Now, I have plenty more of these examples, but I'm not going to go through them all today. Instead, I'm going to track along and talk more about why we've included this. We talk about finding accurate healthcare information in our sessions with young people because we know that they're accessing social media and that this storytelling element is really powerful and validating, but reminding them that this information isn't fact-checked, to instead then look for trusted sources for facts. So an easy trick for young people, especially those in primary school that we teach when we first get like kind of access to them through health education, is talking about, if you're looking on a website, look for .org or .gov in the URL of the site to show that that is an expert place to be looking. And also then telling them, It is okay if you're using these things, looking up things to find health information, but check that information with a professional. Take it to a trusted adult or take it to a health worker, a doctor, a nurse. You can even, like, for example, if something's a bit more of an emergency situation, you found out this information online, and you're thinking about, for example, taking certain medication, you can give doctor on call or nurse on call a call, and they can talk you through and then potentially like lead you on to the right kind of experts or the right kind of professionals or healthcare workers in your life to talk to about this information, because at the end of the day, we all want people to live healthy lives, and these professionals will work together. It's not necessarily a conventional approach. However, we know that young people are using TikTok search bar to find out healthcare information. So instead of shaming them, which we know if we say don't do that, you shouldn't be doing this, be like, okay, you're using this, but here's how instead how you can interpret that information, and building those health and digital literacy skills together. So this work, building health literacy, building health equity within these programs, and using an upstream approach helps build young people's health literacy skills. It provides them with accurate information when they're young, like I've said before, and building their skills in understanding what information is trustworthy or not. Again, it all leads to help seeking, that is earlier. So it means there's earlier support, both medical, which I focused a lot on, but also it leads to emotional support, which I don't often emphasize enough. But if a young person knows that what they're experiencing is not what should be expected from a period earlier in their life, that means they can talk to people about it earlier and get more support, and be able to find help in different ways, especially in an emotional and mental element. Um, the way that we set up this program is showing that education is important for everyone, even if they won't get a period in their life. It builds that empathy and builds knowledge on reproduction and fertility. So now I'm going to quickly take you through our menstrual health and pelvic pain program to show you what we're doing, and how people can learn from it and take elements that will work best for their setting. As I've mentioned, this is funded by the Victorian Department of Education. We're delivering these sessions from 2025 to 2027, and it's to support the Free Period Product Initiative. It goes from year 5 to year 10 Victorian government schools, and this program not only includes student sessions, but also professional development sessions that will be available to school staff. And there will also be resources developed and made available. I believe it's in August that our professional development and these resources will be available for free for people to access. Like I said, it is from years 5 to 10, and 30% of the sessions that we deliver in this program have to be delivered in a regional context. Each school that does this program is eligible for 1 to 2 sessions. And we are aiming to deliver 600 sessions to 400 schools. And I believe that we've already gotten over 100 schools since we started delivering in March of this year. For the professional development sessions, we're doing them all online. There's 21-hour PD sessions. This also includes access to online modules and resources. We are also trying to aim to do at least 3 to 5 of these PD sessions in person, regionally only. We've been funded for PD stuff, but because SHV has all of our PD stuff already set up like online, instead we thought to pool the money to be able to do this regionally, and then potentially in different areas, depending on expression of interest. We can also then package in some of our other professional development sessions, so that if we've been funded to go out regionally to do one of these PD sessions for menstrual health, it's only an hour or so long. We can also then package in some of our other work to make it worth people's time, and also package in the fact that we can do more free work in a certain region. It is advertised to Victorian government school staff. However, if you work with young people in any context, especially in a regional one, we're not going to be denying people entry to this. And 30% of the participants in our PD sessions must come from a regional setting. This program is underpinned by some key topics. So we are not keeping this information secret. This is what we do in our sessions, and other people can use what is necessary, like what is works best for them, what will kind of already work within programs they already have, gaps in content that they already have. So we start off all of our sessions, regardless of the year level, revising anatomy. This can be difficult when we come into a 5-6 classroom if they have not had any type of sex ed before. Sometimes especially when we've been brought in term 1 and term 2, young people haven't had any puberty education at all. It's scheduled for later in the year. So it means revising anatomy can be quite difficult. But again, we're external provider for those that provide those of you who already manage these school sessions. It can be easier to plan out when you put certain topics. We use this revising of anatomy to launch into understanding the menstrual cycle. All of these sessions are lecture style, which is not necessarily the most preferred style to do this in. However, we are only funded for a certain amount of times with different year levels, so we kind of have to make the best use of the time that we have available. When we describe what the menstrual cycle is and the elements of it, we talk about what is expected versus unexpected, so people know when to seek help if they're experiencing things that are not expected of a typical period. We talk about managing periods, so talking about different period products. We talk about understanding pain, where people can experience pelvic pain, saying that it's not necessarily just in the abdomen. It can also be in the lower back, in the thighs. It can be all across different regions of the body. We also talk about health conditions, so talking about things like endo, physical health conditions, but also then talking about hormonal health conditions like PCOS. We talk about help seeking, where people can find accurate health information, and then talking about the fact that this education is for everyone, even if they do not menstruate. The key message that underpins this program and all of our work in this is the question, are your periods impacting your everyday life? This is, if you take one thing away from all of me talking at you for this amount of time, it's I hope it will be this question, because this can really help create your piece of work, and it really underpins everything that we're doing within this program. It's asking this question because often young people don't know what is expected versus not expected, and they need to be asked, and then to order then be able to decide if their experience of a period, or if someone they know's experience of a period is not expected or not. So with this question, what we want young people to take away is an understanding of typical versus non-typical periods and pain, knowing how periods work to then understand when things are not to be expected, and learning how the body works in general. We also want this to ultimately lead to help seeking, whether that's going to a trusted adult or to then go to a health professional or a health worker, and learning how to advocate for themselves and keep asking for help. What we want professionals to take away is that if you're an educator, we want you to be able to try and give young people information about what is expected of a period, to build knowledge and also reduce stigma, but also acknowledge the fact that families and communities play a role in providing this education. And it is really hard when the expectation is placed all on school-based sexuality education to provide everything that is needed for a young person's health journey. If you're a health provider, what we want this question to do is for you to incorporate this question into practice, asking young people if their periods are impacting their daily life. Because at the end of the day, if a person's period is impacting whether they can concentrate in school, whether they are able still to participate in sport and all the things they love, and is typical of their daily life, if their periods are impacting that, then there's something not right and they should be seeking help. Whether it is a health condition or just something else, we still want, like, regardless of the severity, it is important that young people learn that they should be asking for help, because they should be able to do everything that is typical of their day. They should be able to concentrate in class without being severely impacted by focusing and thinking about their periods. Like I said, that this can help young people learn when they need help, because often they don't know that their experience means that they need help. They need to explicitly be told. And this also helps build a strong dialogue between health professionals and patients from an early age. So then as person gets older, they feel comfortable and strong talking to their healthcare provider about these kind of topics. I've been talking for a while, so I'm only going to keep you listening to me for a little bit longer. But in summary, we want to talk to young people earlier, regardless of their gender. We want to be talking about menstrual health and pelvic pain, so that it can lead to both medical help and emotional support, and then working on their digital literacy skills to build their health literacy knowledge as well, so they know where to find accurate health information or know who to ask if they've found information online. And that all being underpinned by that one question: are periods impacting someone's everyday life? If you want more information on the program, feel free to email me at any time. But you can use the QR code on the screen, which will take you directly to the landing page on our website that's all around this program. It'll tell you all the information about student sessions, about PDs, and like when we're going to be launching the PDs, as well as the email to our bookings team. So if you have any questions, for example, especially if you want to access the PD, but you don't necessarily work at a school, or you'd love for us to bring it regionally, send an inquiry through that email, and they will keep note of everything, and they'll be able to answer your questions, especially for this program in better detail than I might. SHV is not the only source of information where you can find out information and resources on this topic. I've got a bunch on the screen, stuff like Endozone, Pelvic Pain Foundation, Trans Hub, 1-800 My Options, all great places people can find information. If you do teach student sessions, if you search SHV on YouTube, we have recently made a new animation on periods that can be used in student sessions. That's really inclusive, and it talks about, like, as you can see on the screen, a little still of the different colors that period blood can look like, which we love using in sessions now. Check out our website if there are other topics that you're interested in, other PD stuff that we do provide, especially a lot of stuff for youth and community workers, people working between school spaces can access for free. We have our lovely podcast, which I am now producing. So if you'd like any topics, or if you would love to talk about a topic on our podcast, just send me an email, because we're always looking to create more content. We have a 5-part series coming out this year and maybe next on menstrual health and pelvic pain, some special episodes directly on menstrual health and pelvic pain within different contexts and working with different communities. I realize I've spoken for a while, probably too long, so thank you. Use my email. That's me done now.